Welcome to Fertile Minds. I'm Dr. Seema Mohiuddin. I'm a CREI accredited fertility specialist working with IVFAustralia. Today I'll be talking to you about ICSI treatment. ICSI stands for intracytoplasmic sperm injection. It is a fertility treatment where a single sperm is used to fertilize an egg. When a couple is going through fertility treatment like IVF, a woman has injections to stimulate the batch of eggs for that particular month so that all the eggs in that batch grow. She is monitored by blood tests and scans to see how her progress is. The blood tests are to check how she is responding to the injections, and the scans are to check how many follicles are developing on her ovaries. Follicles are sacs which have an egg in it, and when the size of the follicles reaches a certain number, she gets a special injection called the trigger injection, which matures the eggs, and 36 hours later she comes for egg collection. The time she comes for egg collection, her partner also gives a semen sample. When the eggs are collected, there are two ways of fertilizing these eggs. The conventional way is there are few thousands of sperms placed on the egg, and we prefer a sperm fertilizes the egg. In ICSI, the sperm sample is processed so that we are seeing motile sperms under the microscope. A normal looking motile sperm is chosen, and the tail of the sperm is striked so that it stops moving, so that it is easily handled, as well as it activates the sperm. The sperm is taken and it is injected into a mature egg at a place which is away from the genetic material of the egg. This is used to fertilize eggs in couples whose fertility is secondary to male factor. It has been there since 1990, and it has helped many couples achieve a pregnancy when they were suffering with male infertility. ICSI is used when there are abnormal semen parameters, or when the sperm is surgically collected by a needle or by biopsy, because the number of sperms when you are surgically collecting it are very few, and they can be only used by ICSI treatment. When a semen sample is normal, but you're used to fertilize a frozen egg, then also we use ICSI treatment, as well as for PGD purposes for monogenic conditions, we use ICSI treatment. When a couple had a normal IVF treatment, when all parameters in the sperm and no issues with the eggs were there, and they had IVF treatment, but unfortunately the fertilization did not happen, and the patient comes forward for a second treatment, we prefer them to use ICSI treatment.